Medicaid now covers more people than Medicare. Medicaid covers about 79 million people compared to 68 million in Medicare, but I think it doesn't get the same attention, primarily because we're talking about low-income people.
Hello and welcome back to a new year of the Rural Impact. I'm Michelle Rathman. It is the 16th day of January, 2025. I turned a year older in December, but I have a feeling that I may age about 10 years of these next 12 months ahead. Maybe you all can relate, but in any event, I can think of no better company than you to muddle through these times with. So here we go. If you're a new listener, I will just tell you real quick that we are, in a nutshell, a podcast that works to connect the dots between policy and rural everything. And I do mean rural everything. Now, in the last episode, it was a very brief episode. It was just kind of a preview of what we have in the works for you for this year. And in that time, I mentioned that we are going to keep a close eye on the incoming administration's policies and how they may or will impact rural. Now, starting with this episode, we are kicking off an ongoing series we're going to call, quite simply, 2025 and the Impact of Policy Shifts. I do believe shifts are going to happen. So we know there'll be no shortage of topics from which to cover, to be sure. And today, we're going to focus on healthcare and really what I believe promises to be one of the most contentious, probably the most challenging for rural, and that is Medicaid cuts, as well as policies around the expansion of Medicare Advantage, which is proving, quite frankly, to be putting safety net hospitals and their patients at a disadvantage on several fronts. So again, you're going to hear about that. And joining me for this conversation, I'm no expert on either one of these topics. I know a lot about them, but I brought the experts with us. And I was grateful to have time with Larry Levitt. And Larry is Executive Vice President for Health Policy, overseeing KFF's policy work on Medicare, Medicaid, the healthcare marketplace, the Affordable Care Act, racial equity, women's health, and global health. Now, after hearing from Larry, it was really great to have Edwin Park join me. And Edwin is a research professor at the Center for Children and Families, McCourt School of Public Policy at Georgetown University. And Edwin has done extensive research. And as a matter of fact, some big news came out on that front this week. So you're going to have to go to our show notes to read about that. But what really drew me to pay closer attention to Edwin was an article that he penned in November of 2024. And the headline read, this gives you a little bit of preview of our conversation, Congressional Republican leaders start to show their hand. Draconian Medicaid cuts on the agenda for next year. Well, here we are. It's next year. And again, this is a very important policy discussion for us to be having. And before I shift to these conversations, I thought, let me just give you a bit more context about why Medicaid cuts matter for rural, even though you may not be, if you may not think that you are directly impacted by them. But I think by the end of this episode, it's very likely that you will see how indirectly that it impacts you on either side. So first of all, notably, rural people are much less likely to be covered by employer-provided insurance. This is not an opinion. This is well documented. And as we've covered in past episodes, we also know in general that the rural job market pays less than other places. So what does this mean? Any increases in health insurance premiums will be financially challenging for millions should Congress allow the enhanced premium tax credits. Remember those? They're called PTC. Should they allow those to expire in 2025? And to help understand where we are, let's go back just a little bit. And that is back in March of 2021, these credits made health insurance far more accessible in three really significant ways. The first is that the increases substantially increased the subsidies available to buy insurance in the marketplace in the first place. It's important to note that the legislation also extended eligibility for PTCs to people with incomes above 400% of the federal poverty level. And lastly, on this point, I'll just share with you that it ensured Very important that enrollees with incomes between 100 and 150% of the federal poverty level could get coverage without having to pay premiums. Very significant for those folks. Now, since then, marketplace plan selections have risen from 12 million to roughly 21.4 million in 2024. That's a big number. And because Medicaid plays such a large role in small towns and rural areas, any changes to the program are more likely to affect the children and families living in small towns and rural communities. So I think that's really important. I believe it is important to you as well. And that's why we're bringing this conversation to you. Another important side note before we move on, a dot to connect, if you will, is that we know that states without expanded Medicaid will see the largest effects, but they won't be alone, because we also know that rural areas will once again contend with skyrocketing premiums, limited choices, which is already a challenge for so many rural communities. You may have already experienced how challenging it can be to just get in to see a primary care provider, let alone any kind of specialist. And the icing on this crud cake, as I'll call it, is that as it stands right now, we do know that 50% of rural hospitals across the U.S. are operating at a negative margin. This simply is not sustainable. Big picture, the more uninsured does not mean the need for healthcare just disappears or dissipates or curtails. It means that already struggling hospitals will be already, as I said, operating on thin ice, will have more patients to care for without a pathway to payment. And that is hard to operate without reimbursement. Then what happens? So I won't speculate. I'll just leave it there and ask you and invite you to connect those dots as you're listening to this conversation. Now, as I say often, I know these are not light subjects, but in the end, I do hope my conversations with Larry Levitt and Edwin Park and the others that we're going to have in these series do enlighten you. So with that said, I'm going to keep going with this. I invite you to sit back, get yourself into your podcast frame of mind, and listen to this important conversation about Medicaid cuts with Larry Levitt and Edwin Park. Are you ready? You know I am. Let's go. Hey, Larry Levitt, Executive Vice President for Health Policy at KFF. Welcome to The Rural Impact. Thank you for being here. This is a very important conversation, and I cannot think of anybody better than you to kick us off. Welcome.
Thanks for having me.
All right. Well, as we were kind of talking before we went on air here, one of the things that we saw during the 2024 election was that threats to Medicare and Medicaid were not reflected in the polls, which quite frankly was shocking to me, but I don't know really why that is. But there was other things I wanted to cover. And certainly the media in general did not indicate that these were concerns for voters. So here we are. We are now going into the second week of January. This one will drop at the second week of January. And we know that should there be cuts or a repeal of federal financing for expansion of Medicaid, the impact will be felt by many and in many ways. We could speculate, but you know more than most. So keeping this in mind for this conversation, Medicaid plays a significant, central role in helping fill the gaps in coverage in rural areas. And that includes for our safety net hospitals. They rely heavily on those payments. So let's start off this not light subject conversation, Larry, by offering us some numbers, because even this morning, you posted something. What do we know about enrollment in state by state, which is a great way for us to understand the implications, and who will be impacted by health policy shifts, noting that the biggest growth in enrollment has been in the so-called red states?
Yeah. So if you think about our public health insurance system, it's three big programs now. It's Medicare, Medicaid, and the Affordable Care Act.
Mm-hmm.
And we're talking, roughly 160 million people nationwide who depend on those programs. And as you said, it's true in every single state with some differences, which I'm sure we'll get into.
Mm-hmm.
And I think for a long time, Medicare has been seen as a third rail of American politics, that you can't touch it. And for example, even in the campaign, President-elect Trump said that he would not cut Medicare or Social Security. He was conspicuously silent on Medicaid. Interestingly, Medicaid now covers more people than Medicare. Medicaid covers about 79 million people compared to 68 million in Medicare. But I think it doesn't get the same attention, primarily because we're talking about low-income people, not
And
seen.
children.
And children, absolutely. Low-income adults, low-income children, and in fact, low-income seniors and people with disabilities as well. The Affordable Care Act, you mentioned that the government just announced record enrollment in the ACA. This has been driven by enhanced premium aid, which was passed by Democrats in Congress and signed by President Biden. And that enhanced assistance has fueled record enrollment of 24 million people. So as Donald Trump takes office, we've seen record enrollment in the ACA, in fact, record enrollment in Medicaid as well, and the lowest uninsured rates we've ever seen. And a lot of the growth in enrollment, particularly in the Affordable Care Act, has in fact come in red states. And that's particularly red states that have not expanded Medicaid eligibility under the Affordable Care Act.
I think there's a reason why they don't want to talk about it, because obviously. So let's talk a little bit about the implications of Congress allowing. So these subsidies, if you will, they're extended through 2025.
That's right.
And so, whether or not President-elect Trump is talking about it, members of Congress are. So what are the implications? I really think it's important for our listeners to understand what happens should Congress allow enhanced ACA financial aid to expire state by state, because there is no it's a cookie cutter approach, really. I guess it depends on where you live, where your zip code is.
Absolutely. Depends on your income, where you live, how big your family is, your age. But I think, we talk about, and even I talk about this enhanced premium aid or subsidies in a somewhat sterile way. It has been very, very meaningful to people. So to put some numbers on it, the average amount of this extra premium assistance that people are getting is about $705 per year. If that premium assistance expired, people's out-of-pocket premiums would increase by upwards of 80%. So premiums would skyrocket for people who are getting this aid, and enrollment would fall. I mean, millions of people would lose coverage without this extra premium assistance. And as I said, it's particularly important in those states, all red states, that have not expanded Medicaid under the ACA, and that's because very low-income people who would otherwise be eligible for Medicaid are instead eligible for these ACA subsidies.
And we are not talking about people who are unemployed. I mean, we are talking about people who use this program and are still maybe working 2 or 3 jobs just to get by because this is a condition. And Larry, I wonder if you could, just opine a little bit about, it's not just about people losing their coverage, but what happens to the people who provide care? Because the people who lose their coverage still presumably need health care. And so let's talk a little bit about, if you wouldn't mind, a little domino effect. What happens then?
Absolutely. So, and as you said, I mean, the people who are receiving both the ACA premium assistance and Medicaid are overwhelmingly working people. And as you said, often working, struggling with a part-time job, working multiple jobs. And there very much is a domino effect. I mean, one of the effects of expanding coverage is certainly to give people better access to healthcare, more financial security, peace of mind, better health ultimately. But the providers who provide care to people who are eligible for these programs see improvements in their finances and fewer non-paying patients or less uncompensated care. And we see that in the numbers. I mean, rural hospitals certainly struggle. We know that, and they've struggled particularly recently. But rural hospitals in states that have expanded Medicaid under the Affordable Care Act have noticeably better finances, higher margins than hospitals in states that have not expanded Medicaid.
Yeah, this is so true. I want to shift the conversation a bit to the term, the trigger laws, because I looked at the maps. And KFF does an amazing job. I love the maps. They tell the story very simply. So we get to a place where we have a Congress that says, nope, we're moving in this direction. And then what happens to the states that have those trigger laws? Because to me, the visualization in my head is that we just push a bunch of people off a cliff and everyone has to figure out if they have a parachute or not. Maybe that's a fair analogy. I'm not sure.
Yeah. So there are, I think there's a lot of expectation that the Republicans in Congress and and President Trump will look to cut Medicaid in the coming year. And in some ways, the math is inescapable here. Republicans are looking to put in place big tax cuts, which will cost a lot of money. President Trump has said Medicare and Social Security cuts are off the table. House Republicans have talked about cuts in federal spending of amounts like $2.5 trillion over 10 years. So if you take Medicare off the table, Social Security off the table, defense off the table, that leaves Medicaid as the biggest program in the federal budget with a big target on its back. And there are a number of ideas being talked about. I mean, there's ideas like a block grant, capping federal spending and turning the money over to states with much more flexibility, or eliminating that Medicaid expansion. And the Medicaid expansion under the ACA covers about 21 million people. As you said, a number of states have trigger laws that if the federal government cuts back on its matching payments for the Medicaid expansion will go away immediately in those states. But I think the reality is, we're talking about so much federal money that if that extra federal money for the Medicaid expansion goes away, virtually every state is going to cut back on the Medicaid expansion because states just can't absorb that kind of money. So we're talking about potentially, over 20 million people losing coverage.
I can't even wrap my brain around what that looks like, like waking up one day and then that just blows up the entire thing. So let us do another shift here because it's very much related. Talk a little bit about the incoming administration's views. I've read Project 2025, although there's been, some kind of hope to disassociate the two. But if we lay the concepts of a plan that we're hearing about over the top of Project 2025, they do have quite a bit of connectivity there. Let's talk about views on health policy, those vulnerable populations who rely on this, rural, underserved areas, high-risk populations, with caps in place, or they call them the block grants or the caps in place. What do you anticipate happening at the state level? Because now we have to turn inward, I think, and state legislators and leaders need to have a plan.
Yeah, no, and I mean, this is, and this is not just a blue state issue. It's an everywhere issue that, Medicaid, federal matching payments for Medicaid are the biggest source of federal revenue in states. As I said, most people on Medicaid are working people. They're working in jobs that don't have health benefits. They're low-income early retirees. This is a very vulnerable population. So, if you imagine the federal government capping the amount it will spend on Medicaid, that just shifts the risk downhill to states. There'd be a lot of pressure for states to make up the cuts in federal spending. And again, we're talking potentially trillions of dollars over a decade. But states have to balance their budgets, and the money has to come from somewhere. So
on the backs of patients.
Yeah, on the backs of patients, states are going to be reluctant to raise taxes. They're certainly going to be reluctant to cut education or public safety. So this just shifts the risk to states, to patients, to providers that are serving those patients.
Yeah. And then I, down the road, I look at researchers, not you or I, but those who will then say, oh, what is the connection between poorer health outcomes and, a new swath of uninsured population? All right, let's shift the conversation a bit because overall, there's an agency that will be handed over to somebody else. And right now, the President-elect Trump's pick to head CMS is Dr. Mehmet Oz, who is favorable to Medicare Advantage plans. Because I have a background in rural health, I understand what Medicare Advantage has done to the financial situation for rural hospitals, and it's not good. So let's talk about the impact of if there's a shift from a push for more Medicare Advantage and what that does to the highest percentage of patients with Medicaid. I don't think folks really understand how these two are going to, collide. I wouldn't say that they're going to get along famously. They're going to collide.
Yeah, no, that's right. And Medicare Advantage, there has been a long time effort among conservatives to privatize Medicare. And to some extent, they've won at this point. More than half of Medicare beneficiaries are now in private Medicare Advantage plans. And there are trade-offs in those plans. As you said, Those plans are often difficult for providers, particularly rural hospitals, also difficult for patients with high healthcare needs because the plans have more limited networks and have
Right.
prior authorization for services, which is not the case in traditional Medicare. On the other hand, these plans are often available at no premium for beneficiaries with extra benefits and lower cost sharing. So it's very appealing for many people. We've seen proposals like you mentioned in Project 2025 to really even accelerate the privatization of Medicare,
Mhm.
turning it into effectively a voucher program and making private Medicare Advantage plans the default rather than traditional Medicare. I think there would be a big pushback among hospitals, but that is a natural outgrowth of the kind of policies we've seen from conservatives over the years.
Mhm. So really 2025 is going to be a very bumpy ride where health policy is concerned. In particular, when we're talking about Medicaid, what else should we be watching for? What's on your radar screen that you've got that you think our listeners should be? And then I have another question about advocacy, if you don't mind. But what should we be watching for, Larry?
Yeah, I mean, a whole set of issues. I mean, as you said at the start, healthcare was not a big topic in the campaign, but that doesn't mean it's not important to voters, and it certainly doesn't mean that we're not going to see potentially big healthcare changes. In addition to changes in Medicaid financing, I think there's also going to be a push for work requirements in Medicaid, and as I said,
Mhm.
most Medicaid beneficiaries are working. But these work requirements create an administrative burden for people to report work or report exemptions, like caring for an ill family member. And where a work requirement has been put in place, we see lots of people dropping out of coverage. I think in public health, it's going to be depending on who gets confirmed. If RFK Jr. gets confirmed as Secretary of HHS, he has been an outspoken opponent of vaccines, and even if he doesn't have the ability to pull vaccines off the market, speaking as the head of the largest health agency in the country, what he says will carry a lot of weight.
This is so true. Our previous episode, our last episode of the year, last year we talked about disinformation and public health and the potential dangers there as well. Well, we welcome you to come back anytime
Oh,
you've
I'd
got
love to.
news because the list is very, very long. I know we should be looking at what's going to be happening with prescription drug costs. We had made some gains. Let's see where we go there. Workforce loan forgiveness. I'm thinking about rural healthcare workforce, but healthcare workforce in general, and the visa programs that are tied to those. So I'm sure your newsroom is quite busy these days.
Absolutely.
Tell our listeners where they can follow you.
Yeah, so certainly our website, kff.org, has a wealth of healthcare information. And I am trying to be continuing to be active on social media, on Twitter, X, on Blue Sky, trying to get facts out there.
Yeah, and one last thing I want to say, we talk so much. I mean, this podcast is about connecting the dots between policy and real everything and advocacy, I think, more than ever. And I think I just want to tell our listeners, if you are looking for advocacy material, data and facts matter. And so I would say that the information that you all put out are very important for our efforts in becoming educated. And maybe, Larry, one of the reasons why Medicaid in this conversation was not on voters' radar screens because we're just not talking about it enough in the context where people can wrap their brain around it in everyday life. Maybe that's the problem.
Absolutely. And these issues matter to everyone. I
That's
mean, we
right.
saw, at the end of last year, after the murder of United Healthcare executive Brian Thompson,
Oh, yeah.
and just an outpouring of angst among consumers about the problems they have with health insurance. And it was a
Mhm.
moment where people were telling their stories. Whether that translates into policy action is a different question, but it's a really good example of how much this matters to people and how much it's on their minds.
Indeed. And that's where it is, policy. I mean, that we cannot, it's not about pointing the finger. It's about getting to the root and making something different happen. Oh my gosh. Larry, I cannot thank you enough for your coming again. And I say, come back anytime you have news for us. We welcome that.
Oh, I'd be happy to. Thanks for having me.
My pleasure. Okay, don't go anywhere because we are coming back right after this break to continue our Rural Impact 2025 Policy Shifts conversation.
What's the first thing that comes to mind when you hear rural? Is it agriculture, recreation, country, or maybe even elections? Rural can't be defined by one word, one place, or one population. However, we can connect the dots between rural quality of life and policy. And that's what the Rural Impact is on a mission to do. If your organization advocates for rural policies that contribute to thriving rural communities, we invite you to join our partner network. By joining us, you can tap into a wealth of resources, expertise, and a network of like-minded organizations. Discover how we can help you expand your rural reach and share your impact. Visit theruralimpact.com to connect with us. That's theruralimpact.com.
Hey, we're back. And now, we're going to continue this conversation. So it's my pleasure to welcome Edwin Park, research professor at the Center for Children and Families at the McCourt School of Public Policy at Georgetown University for Health Policy, to the Rural Impact. Edwin, thank you for joining us. This is a really important and timely conversation.
Yeah, thank you, Michelle. Thank you for having me.
All right. So I'm going to just say, full disclosure, I do follow your work. We've spoken with your colleague, Joan, in the past. And on November 18th, you wrote a blog that really, I think just the headline alone just screamed at me. And I've had it pinned on my desktop ever since. And I mean that. And the headline, for those of you who didn't read it, goes like this: Congressional Republican leaders start to show their hand. Draconian Medicaid cuts on the agenda for next year. Could not have said it better. So one of the things that I said at the top of the episode was that for many reasons, Medicaid and Medicare managed somehow to drop off the radar during the 2024 election. And frankly, as I've said, Project 2025 never made it on most of the radar screens out there, unfortunately, especially where this issue is concerned. And in the blog that you share, you have a chart comparing the prominent conservative GOP plans, which include severe Medicaid cuts. That's no secret. And as we talked about with Larry just before you joined us, we talked about caps or block grants as they're called. But let's start by having you tell us about some of the other proposals around cutting federal Medicaid funding that target the Medicaid expansion or in some cases limit the ability of states to finance their Medicaid programs. I shudder at that thought. And then from there, let's get into how states facing these cuts will have no choice but to cut eligibility and the benefits and / provider payment rates and all those things, the domino effect, as they say, that will happen as a result. So it's a mouthful. Let's see if you can enlighten us.
Sure. So, one of the things that congressional Republican leaders have been saying is we're not going to repeal the Affordable Care Act. Again, there's not going to be an effort like there was in 2017 in the first Trump administration. But one of the proposals that is being floated to achieve really deep Medicaid cuts, they're talking about, $2.5 trillion in spending cuts to help pay for the trillions of dollars in tax cuts that are likely to be extended this year. Mm-hmm. And one of the targets is Medicaid. There's been a lot of pledges to protect Medicare to some extent, to protect Social Security, but it's notably silent. The Trump campaign and now the Trump officials, congressional Republican leaders have been silent about Medicaid. And one of the proposals that has been floated in a number of areas, including among House Republican leaders over the past year or so, is reducing the federal financing of the Medicaid expansion, which currently covers about 21 million people in 40 states. And right now, the federal government picks up the vast majority of states' Medicaid costs related to the expansion, 90% on a permanent basis. And under these proposals, that 90% will go down to a much lower rate, 57% on average. So in other words, states are going to have to kick in a lot more of their own money to pay for the expansion. So that means it's not going to be financially sustainable over the long run. And in fact, there's some states where any reduction in that expansion port automatically turns off the Medicaid expansion. So
the trigger law, as you're talking about?
9 states have these so-called triggers. And if there's any reduction in Arizona, if it's any reduction below 80%, the expansion just turns off right away. And so this would have the effect of taking away coverage from millions of people across the country in the expansion. So it's really about effectively repealing the expansion, even if it's not explicit repeal. This other proposal is called relates to provider taxes, very wonky, very technical.
Yes.
But states have to come up with a portion of the cost of Medicaid. That's how Medicaid works. And one way they do is provide assessments on hospitals, nursing homes, health plans, other healthcare providers to pick up a portion of their costs. And all states but Alaska rely on these taxes, increasingly rely on these taxes, and there's proposals to make it harder for states to use these taxes or even outright eliminate that use. And so if you have these caps that you discussed with Larry earlier, you have these changes to the Medicaid expansion, other cuts to federal funding, and you make it harder for states to generate their own funding, that's just a recipe for huge state cuts to their Medicaid programs over time.
And a lot of suffering in a lot of ways. And I want to, because we do focus on the implications for rural. And as you and I both know, and I hope that our listeners by now know, that rural residents absolutely disproportionately rely on Medicaid for their coverage. And that also means the health service provider, those who are providing care. So let's talk a little bit about that. I mean, we talk red, blue, and at the end of the day, Larry talked to us about the fact that this is not a red state or blue state issue, but reliably, anywhere where there's rural, which is everywhere, this has significant implications. Talk to us a little bit about that.
Sure. Residents of rural areas, small towns, they have less access to employer-sponsored insurance, and so they tend to rely disproportionately on Medicaid for health coverage. That's particularly the case with lower-income rural residents, as well as, because of that, rural hospitals, other healthcare providers, rural health centers disproportionately rely on Medicaid for their patient revenues. So, if you look at research we've done, 47% of kids in rural areas are covered by Medicaid compared to 40% of those in metropolitan areas. And similarly for non-elderly adults, it's 18% in rural areas versus 15% in metropolitan areas. So if you are cutting federal Medicaid funding, you are taking away coverage that will impact rural families, and you'll also be affecting the hospitals and other healthcare providers, in these areas, which already operate under thinner margins in rural areas. And that's why, the Medicaid expansion has been such a lifeline for rural hospitals when they've been adopted by states. And in states that continue to not take up the expansion, a lot of rural hospitals, unfortunately, have been closing.
Because you cannot look at this issue in a silo, because it just spreads across. And I think about, for example, what happens, the importance of federal Medicaid funding to state budgets. And I wonder, Edwin, if you guys are talking to state leaders, are they just waiting for the ball to drop? Are they planning for it? How do you plan for it? What can you talk to us about, what this is going to look like at a state level? And I recognize that not every state is created equal in this particular case, because what's happening in Illinois, for example, is going to be different about what's happening in Oklahoma or Texas.
Yeah, if you look at the total amount of federal funds that come into state budgets, 56% nationally come from Medicaid. And so it's a huge portion of states' funding. And, it'll vary a little bit by state. But if you are withdrawing, cutting a big portion of that funding coming into state budgets, they'll have no choice but to cut their budget. And when we're talking about Medicaid, the biggest spending priority for states is K through 12 education, higher education. Medicaid is third in terms of states funding. But if you're taking away all that federal funding or you're cutting it dramatically, states are going to have to slash their budgets, and it's going to be a big effect. So this is really federal government acting, states left holding the bag, and in fact, state policymakers being blamed, because they're going to have to think about how we're going to cut Medicaid, how we're going to make our, budget numbers work, because in general, they have to balance the budget, unlike the federal government.
And there's no sugarcoating it. You can't look, right now you can't look around with a House and Senate, and you cannot look around and try and shift the blame, if you will, somewhere else. And you're right, they're going to have some significant decisions to make. And with just the cuts alone, when you take the flexibility out of it, Larry and I were talking about this. Some of the ACA extensions go through the end of this year, but when we remove some of the flexibility to not make Medicaid better, but in fact put in more provisions to make it harder, what is it going to look like now with work requirements and things of that nature? I am just curious what the research will tell us down the road what the impacts will. We don't know that yet, but we can certainly anticipate what that's going to look
Yeah,
like.
and I think states will look to be, slashing enrollment, reducing already low provider payments, taking away benefits, restricting benefits, charging higher premiums and copays to make people's healthcare costs go up. And, people are going to lose coverage. People are going to, forego needed care that they need, whether it's acute care, long-term services and supports. And, there's a large and growing body of research that shows that, Medicaid in childhood has huge long-term effects. Better health in adulthood, less incidence of disability, higher educational attainment, finishing high school, going on to college, completing 4-year college with a degree, and higher income and more economic productivity and stability as adults as well. And, that means that those who are going to lose coverage or not get the services they need, we're not just going to see the impact in the immediate time frame, but, over future decades.
Oh, for sure. And I think there'll be, to your point, some immediate impacts, and then those longer term that, we can't turn back the clock. We're just going to see in real time some of these things happen. Let me just talk to you just a moment. This one struck me a bit. Doing away with federal oversight of state Medicaid programs. Is it not the argument that one of the reasons why we need reform is because Medicaid is being abused in some cases? So I find that interesting. And that comes from the Project 2025 plan, where there would be, kind of do away with oversight of the state Medicaid programs. That doesn't seem logical to me, but go ahead.
Yeah, it often is this a feature when the federal government, caps block grants, federal programs. If you look at the experience in the past, once the federal government does that and sort of washes its hands of, long-term sustained federal commitment to, healthcare in the case of Medicaid, but other programs in the past, it also says states, we're giving you this limited amount of money. We've capped how much we're going to contribute, and you can do with it what
You're
you
on
want.
your own. Right.
And we've seen that, unfortunately, with TANF program. When the AFTC program was converted to a block grant, the TANF block grant during welfare reform. And then, there have been stories, including most recently in Mississippi, about TANF funds being diverted to, building a gymnasium for a university rather than going to support struggling families. And, that would be, one of the things that we'd be worried about is not only is Medicaid going to have to shrink dramatically, people are going to lose coverage, but, whatever remaining dollars are available won't be used wisely, won't be used effectively to actually provide healthcare services to vulnerable individuals and families.
Yeah, and I have my eye on, you and I both know that we have so many vulnerable rural health systems, rural hospital closures. We've got these rural emergency hospitals. We've got OB deserts, like, to the tune of, the information is out there and available. And so I know that for those families, for those mothers and children, the pain is going to be felt deeply. And speaking of that, so I also want to connect the dots between capping Medicaid and budget cuts to other states, as you said earlier, Edwin, to programs K through 12. And that also includes things like WIC, SNAP benefits, and so forth. So we can imagine that cuts to one will be, it's a death by 1,000 cuts, maybe is the term.
Well, and I think you can look at it in a number of ways. You're going to put a lot of pressure on states, shifting costs to states for Medicaid. And so they're trying to preserve parts of their Medicaid program. That means, again, you're cutting other parts of the budget, K through 12 education, higher education, other low-income programs. But also, it's the same families who rely on Medicaid as they do on SNAP and WIC. And so, they're going to be facing, much greater difficulty, financial difficulty because of cuts. And of course, these other low-income programs could also be on the chopping block, particularly SNAP, as part of these budget proposals from congressional Republican leaders. And that would be devastating. And then the last point is, Medicaid plays such a vital role across a whole host of arenas. And, for example, we think of schools and Medicaid as separate, but Medicaid actually finances school-based health services,
Yes.
including mental health, behavioral health services. And so if you're cutting Medicaid, you're affecting, how kids are going to be able to do in school, attend school, if you're going to be taking away, Medicaid funding that states, schools are relying on in many states to support their supportive healthcare services.
I think about community health worker programs and all the grants and things that come out of CMS right now and HHS right now to help with prevention. And so what I want our listeners here, and we'll be watching what comes out of your space too, Edwin, is that, I don't, and I hope I'm wrong, I don't see an influx of resources to help address prevention, social drivers of health, and so forth. I see the cuts, it's just slashing across the board. And that concerns me perhaps more than, that's why I lose a lot of sleep at night, quite frankly.
Yeah, I think there's been a lot of innovation taken up by states working with hospitals, physicians, managed care plans to try to figure out how to address social determinants of health, help with housing,
Health equity,
nutrition, and Medicaid is looked to as a key component of those efforts. And if Medicaid is cut, certainly many of these initiatives can't move forward and they can't expand and they can't be taken up by more states in coming years. So I think, Medicaid is certainly, playing so many different roles. And if it's on the chopping block and if those cuts, or at least some of them, get enacted, it's certainly going to have, major negative effects across the board.
absolutely, in so many areas. And I think about workforce and what that does to workforce and public health and so forth. All right, before we head out, I know you've got a little report coming out. This episode is dropping on next Thursday. Today is the 8th of January. So you are releasing, when this comes out, you have already released the Georgetown CCF report on Medicaid coverage rates in rural areas and small towns. Can you give us a sneak preview of that?
Sure. So we have a report that we come out every so often, which looks at Medicaid coverage rates in rural areas and small towns as compared to the coverage rates in metropolitan areas. So this county specific. And this year we'll be showing the coverage rates by kids, non-elderly adults, and seniors. And as one would expect, consistent with past analyses, Medicaid plays a vital role for health coverage for all three groups and disproportionately so among kids and non-elderly adults in particular. And so we'll have interactive maps and other data available next Wednesday on January 15th.
Wonderful. The day before we drop. And folks, be sure to know this. We're going to put that on our resource page. So you, of course, we'll take you right to your page, Edwin, to make sure that people can read that, and we'll be watching for it. Before we close out, final things of what we should be watching for, because I think reports like what you've just described, they help us in our advocacy efforts. For people who believe that they can't do anything about it, there is a way. Pick up the phone, you call your member of Congress, you call your state legislators, and when you have data in hand, it helps to help them understand why it's so important for them to not just go along party lines and really take a look at these issues and how it impacts their constituents. But what else should we be watching for this year? It's going to be a very busy policy year, to be sure.
Yeah, I think just to end with the fact that these Medicaid cuts, which are very serious, very severe, very worrisome, are not inevitable. There's been efforts to deeply cut Medicaid in the past, most recently in 2017,
yes,
with the repeal and replace effort, and it failed. And for example, the caps that you discussed earlier, that's been something that's been pushed in Congress since 1981, and there's been multiple efforts, and again, all of those have failed. So data, storytelling, talking about how Medicaid plays a role in your family, with your neighbors, with your community is going to be vital to, translate or explain how Medicaid is so valuable, so important, what it does, as part of our healthcare system, as a part of people's lives, will be instrumental in, pushing back on some of these, very damaging proposals.
Yeah, and I think if people understood what it meant for their own local economies, it is all connected, and it's nice to kind of think about it. This doesn't concern me, but it does. Whether or not you use that part of the system, ultimately, it does impact your small rural community. Oh my gosh, Edwin, before we close out, where can people follow you? Where besides your website? And we'll make sure we put all those links in our resources. Where can we find you?
So on our website, ccf.georgetown.edu, and then you can follow me on Blue Sky at Edwin C. Park.
Yes, it's so nice to see you where the skies are blue, as we say. Edwin, thank you so much for joining us. And I'm going to say this will certainly not be the last conversation on the matter because I am heading to Washington, D.C. I will be recording from the National Rural Health Association Policy Institute, where I have just learned this morning that your colleague, Joan Alker, will be presenting, I'm sure, talking about the paper you just mentioned. And while I'm in our nation's capital, I'm going to bop over to the National Association of Community Health Centers meeting. And if you don't know about them, they represent our nation's federally qualified health clinics, and they've got a lot on their policy agenda as well. And so we're going to just keep focusing on this special episodes on our 2025 policy issue shifts. Shift is going to happen, as they say. As I said in our kickoff episode, just keep on watching what we're doing here and see how we can help you connect the dots between your quality of life and policy in rural America. A big thanks to Bria Corsaro and Sarah Staub, as always, to all of our listeners and subscribers. Come back and join us again on a new episode of The Rural Impact. But until then, I always say, and I mean it, take good care of yourself and everyone else around you. We'll see you soon.